Okay, so our topic for today is about the healthy newborn. And when we deal with healthy newborn, as mentioned before, doon sa labor and delivery, this will be the continuation of the EINC or the Essential Intrapartal and Newborn Care. For the newborn care part of the EINC, always remember that there um, are the basic needs of a baby at birth. The objective is for nurses to describe and carry out the evidence based routine care of a newborn at the time of birth and, most importantly, to prevent complications. The baby must breathe normally at birth, the baby must be warm, the baby must be protected, and the baby must be fed. Now, there are four core steps of essential newborn care. The first core step is immediate and thorough drying. Second is early skin to skin contact. Third is properly timed cord clamping. And fourth is non separation of the newborn and mother for early initiation of breastfeeding. Ito yung four core steps, which means ito muna yung uunahin before any other intervention or any other activity na gagawin as soon as the newborn is born. At the time of perineal bulging, no, in preparation for delivery, we mentioned before that the delivery room should be within 25 to 28 degrees Celsius, free of air drafts. How do we check for air draft? So you can use a tissue paper to check for air draft. Notify appropriate staff. Arrange the supplies in linear fashion. So may dalawang linear equipments na naka-prepare. Check newborn resuscitation equipment if working. Wash hands and do double gloving. Only if mag-isa lang yung person na magde-deliver. EINC is designed for only one person. Pero kung merong iba na katulong or kasama yung nurse para magpaanak, no need for the double gloving. Within the first 30 seconds, it's very important that you dry the baby. It's the first step of essential newborn care. Do a quick check of breathing while drying. Yung pagpapatuyo kay baby, dalawa yung nagiging purpose niya. Una, tinuyo mo siya para ma-prevent ang hypothermia. Pangalawa, nung tinutuyo mo siya, sinestimulate mo na rin yung respiration niya. During the first seconds, do not ventilate unless the baby is limp and not breathing. No need to suction also unless the mouth are blocked with secretions or other materials. Suctioning is not a routine anymore, unlike before. Kasi yung pag-introduce ng suction tubes to the baby may just increase the risk of infection. Within the first 3 minutes, no, you thoroughly dry the baby. Important notes, do not wipe off the vernix caseosa. Yung vernix caseosa, siya yung cheese cream-like substance covering the baby. And hindi dapat ito wina-wipe off after birth kasi tumutulong ito for insulation or thermoregulation. Do not bathe the baby immediately. You may wait until 6 hours bago paliguan ang baby. In fact, kung hindi siya paliliguan within the first day, that's okay. Do not do footprinting. Hindi na footprints doon sa stamp pad na iisa lang naman for almost all babies. So, ito lang ay nag-i-increase ulit ng risk of infection kasi yung stamp pad na ginagamit is not ideal or is not one baby per stamp pad. Plus, hindi rin naman ito nagiging proper use of identification kasi yung mga sole creases ng baby nag-iiba, no, as the baby grows older. No slapping, no hanging upside down, and no squeezing of chest, Noon, ginagawa ito to stimulate respiration. This may cause injury to the baby. Instead, to stimulate respiration, habang tinutuyo mo yung baby at pinupunasan mo siya mula ulo hanggang paa, yun na rin yung way to stimulate breathing. After 30 seconds of trying, the second essential newborn care or intervention is to promote early skin-to-skin contact. If newborn is breathing or crying, just proceed. Position the newborn prone on the mother's abdomen or chest. You have to cover the newborn's back with a dry blanket. Also, cover the newborn's head with a bonnet. Tuloy-tuloy ito for 90 minutes, uninterrupted skin-to-skin contact. Avoid any manipulation. So, yung routine suctioning, paglalagay ng mga identification band on the ankle, not on the wrist. Kasi sa wrist, no, it may occlude o pwede siyang maging hindrance kapag yung baby ay magsasak ng kanyang thumb. Skin-to-skin contact is also doable even if the mother is cesarean section. Kailangan lang ng assistance ng nurses. For the first 3 minutes, properly timed cord clamping is important also. So, yung nag-double gloving, tinanggal mo na yung first glove mo, and after the umbilical pulsation stopped, you have to clamp the cord using a sterile plastic clamp or tie 2 cm from the base and clamp again 5 cm from the base. And then you have to cut the cord close to the plastic stamp or the clamp. Hindi na tayo nagmimilk ng cord towards the baby. Before, we milk the cord kasi sayang daw yung dugo doon sa umbilical cord. But, milking the cord will just cause many blood problems. Ganun din naman yung early cord clamping. So, kailangan properly timed. You wait for pulsations to stop. Pag very early din ang cord clamping, it can also cause blood problems to the baby. After the first clamp, that's when you can strip the cord of the blood before applying the second clamp. The only purpose is, pag ginupit mo yung cord, hindi sisirit yung dugo. You have to cut the cord close to the plastic clamp so that there is no need for a second trim. And you do not apply any substance on the cord. Before, naglalagay ng betadine, before, naglalagay ng alcohol. What's important now is to just keep the cord clean and dry. And normally, fall off yung umbilical stump in 1 week. Panatiliing tuyo at walang amoy ang pusod. Now, paano siya malilinis? So, ang baby, kung pinapaliguan araw-araw, doon mo lang rin nililinis yung umbilical cord. But no need to put any substance on the cord. Now, within 90 minutes, there should be non-separation of the newborn from the mother. And this is for early breastfeeding. Hayaan lang ang newborn skin-to-skin contact. It's important to observe for feeding cues. Pag nakakita ng feeding cues, that's when you can encourage the mother, nudge the newborn towards the breast. Ano ba yung feeding cues na iintayin natin kay baby? Usually, may mga baby, in a matter of 30 minutes, mag-uumpisa siya ng feeding cues. Feeding cues would include tonguing, licking, rooting, initially the baby will open the mouth also. Crying is a late feeding cue. Now, it's important also to counsel the mother on positioning. Newborn's neck should not be flexed or twisted. The newborn must be facing the mother's breasts. The newborn's body is close to the mother's body, and the newborn's whole body is also supported. Paano yung proper attachment and suckling? Ito yung correct latching on. Sinisiguro nito na feed si baby ng maayos at pangalawa, hindi rin naman nasusugatan o nahihirapan yung breast ni mommy habang nagbe-breastfeed siya. The mother's or the baby's mouth should be wide open. The lower lip of the baby is turned outward. Yung chin ni baby should be touching the breast. And lastly, si baby nagsasak slow, deep, and with some pauses. Minsan may maririnig ka na yung baby nagsasak, may tunog. So, that's not a proper way ng pag-latch on. Uulitin yon and then follow this proper attachment and sucking and also assist with the mother's position. Important that to make sure na nabibigyan ng early breastfeeding, na ibibigay ang colostrum kay mommy. I-minimize ang handling ng health workers. Huwag din tayo magbibigay ng sugar, water, formula, or other pre-lacteals. Do not give bottles or pacifiers. Pero, importante, no, hindi tinatapon ang colostrum. Now, what if there are some cases that the mother is prevented from breastfeeding the baby? Sometimes the mother could be infected or may infection, kailangan silang paghiwalayin, or si mother ay napunta sa ICU or something like that. Remember, there are different supplements or milk supplements. The first milk supplement is expressed breast milk. Ito yung pagkakataon na hindi man pwede si mommy at si baby mismo na mag-feed. Si mommy pwede naman siyang mag-express ng sarili niyang breast milk. Yung second possible supplement is donor's breast milk. Kung hindi kay mommy mismo manggagaling yung milk, it could be from another mother. But still, breast milk yung ibinibigay kay baby. Third is pasteurized. Pang-apat lang ang formula milk. Aside from that, sometimes newborns can be assisted with cup feeding instead of giving them bottles or pacifiers. Also, weighing, bathing, eye care, examinations, injections such as Hep B, BCG should be done after the first full breastfeed is complete. Itong lahat ng ito ay wala doon sa essential newborn care. Yung apat lang ang nasa essential newborn care, which is dry the baby, first, skin-to-skin contact, second, properly timed cord clamping, third, and fourth, yung breastfeed. Pag natapos yung apat na yun, tsaka lang pwedeng isunod yung other intervention, such as this one mentioned here. Now, the skin-to-skin contact, remember, is 90 minutes. Pero kung natapos na ni baby ang first full breastfeed, nang hindi pa naman tapos ang 90 minutes skin-to-skin contact, maaaring gawin ang mga ito habang skin-to-skin contact. Postponing the washing or bathing is okay until 6 hours because by this time, dapat well thermoregulated na si baby at naka-adapt na siya sa environment. Now, if you remember again yung EINC checklist ninyo sa return demonstration, so in 15 to 90 minutes, ito yung mga gagawin. No? Continuation ito sa discussion natin noong labor and delivery na checklist. Advise mother to observe feeding cues, support mother, position and attachment, and importanteng tapusin muna ang first full breastfeed. Pag natapos yon, you were able to finish or promote the 4 steps or the 4 core steps of essential newborn care. And after a complete breastfeed, that's when you can give eye ointment. No? It's a prophylaxis for eye infection. Ito yung neonatal um, infection sa eyes. You have to retract the right lower eyelid outward with a forefinger. Instill 1/4 inch strand of ointment sa lower conjunctival sac from inner to outer canthus. Repeat procedure on the other eye. Pwedeng magbigay ng erythromycin, okay, to prevent neonatal infection or eye infection. Neonatorium. Second is to do thorough physical exam. You can take the weight, measure head, chest, and abdominal circumference, which we will further discuss later. Third is administer vitamin K, could be at right upper outer thigh, and then Hep B, inject at left upper outer thigh, and the BCG vaccine, right upper arm. So you have to remember that vitamin K and Hep B are IM, and CBCG ay binibigay intradermal. Now, also remember that when you give vaccine, such as the Hep B and the BCG vaccine, ang pag-disinfect sa skin, you should only use cotton balls with soak sa cool boiled water. Pwede kang gumamit ng cotton balls with alcohol to disinfect the skin only for vitamin K. And then, advise optional or delayed bathing, which is again 6 hours. Tinuturuan din natin ng exclusive breastfeeding per demand. Ang exclusive breastfeeding, no, there's a world-renowned protocol, which is yung mother-baby friendly hospital na naririnig natin. Sa ibang bansa, fina-follow din yon ang mother-baby friendly hospital. Nag-originate yon dito sa Philippines, specifically sa Baguio General Hospital by Dr. Clavario, Filipino pediatrician. So ito, sinisiguro nila na sa ospital, exclusive breastfeeding ang pinopromote nila at bawal ang bottle feeding. Okay? Remember that newborns would usually require 8 to 12 feedings per day. Usually, 1.5 to 2 hours or 3 hours. Small, frequent feeds lang. Dahil ang newborns naman, ang mga bagong panganak, they have a very, very small stomach. As small as a calamansi. Nasa 1.5 cm lang ang diameter nila. So, mabilis silang mabusog. On the first 3 days of birth, the baby needs protection rather than nutrition. So, importanteng makuha nila ang lahat ng colostrum na punong-puno ng protection. Initially, the prolactin is high. It will produce more milk, no, through sucking. Lactogenesis, there's a lot of milk that will come out in 3 to 5 days. Kaya minsan sa unang 3 araw, iniisip ng mother na hindi pa ganun kadami ang nafi-feed ng baby. That's okay because lactogenesis or milk will come out in a matter of 3 to 5 days. Kung ang baby ay tulog, which is mostly tulog sa newborn, you don't need to wake the baby all the time, no? Because a baby or a newborn needs 5 hours of uninterrupted sleep. Needed ito for brain growth. Also, meron tayong mga law which supports breastfeeding, such as yung Republic Act 128. Ito yung pagkakaroon ng lactation stations even sa mga mall na kung saan yung mga mommy pwedeng pumasok doon sa kwarto na yon kahit nasa mall para magpa-breastfeed. Also, yung pagbibigay ng 40-minute break period in an 8-hour period exclusive for breastfeeding, for example, no? Also, merong Executive Order or EO 51. That's the milk code. Unethical marketing is a crime. Ano yung example niyan? Sa television, meron kang makikita na yung bata naging matalino, yung bata naging genius, mataas ang IQ, magaling sa sports because of a certain milk. No? pag-inom ng gatas na to, yung dahilan kung bakit mataas ang IQ or magaling sa isang field yung isang bata. That's an ethical marketing. All these, of course, under Republic Act also 10354, which is yung Responsible Parenthood and the Reproductive Health Act of 2012. Now, in the first hour, importante syempre, you check the baby's breathing, color, check mo si mommy, vital signs, continue to massage the uterus every 15 minutes, no, for making sure that there is enough involution to happen. And doon sa second hour, check lagi the mother-baby dyad. So, ito yung monitoring ni mommy at ni baby every 30 minutes to an hour. And then lastly, complete all the records. So, yun yung lahat ng events or steps sa EINC protocol. Now, let's discuss the profile of the newborn. We discuss here the vital statistics, the vital signs, physiologic function, and how the baby adjusts to extrauterine life. So first, yung vital statistics ni baby. Getting the weight, length, head circumference, chest circumference, and abdominal circumference. To get the weight, no, make sure syempre na si baby pansamantala, no, kung titimbangin mo siya, kailangan halos natapos mo na yung 90 minutes na skin-to-skin contact, ideally, if you follow the EINC protocol. Una, siguruhin na wala na yung metal clamp doon sa pusod ni baby kasi makakabigat yon. Okay, the normal birth weight of a Filipino newborn is 2.5 to 3.5 kilos. The length, no, normal is 47 to 51 centimeters for an average size Filipino newborn. Siyempre, mula doon sa bumbunan ng ulo hanggang sole of the feet. Okay? Because newborn's legs are flex, no? I-extend siya diretso para makuha yung kanyang length. The head circumference, ano ang point of reference dito? It's the temple. The normal head circumference is 33 to 35 centimeters. Now, the chest is normally 1 to 2 cm smaller than the head. Kaya kung 33 to 35 ang head circumference, ang chest circumference should normally be 31 to 33 cm. Kung sobrang laki ng head, by the way, head circumference, it could mean na baka may increase intracranial pressure due to hydrocephalus. So yung mga nervous system problems, you have to monitor the head circumference every day. Ang chest circumference, now point of reference is the nipple line or the nipples. Next is the abdominal circumference. The abdominal circumference is 1 to 2 cm smaller than the chest. So kung ang chest ay 31 to 33, abdominal circumference is 29 to 31 cm. Point of reference, just above or just below the umbilicus. Huwag siyang on the umbilicus kasi may umbilical stump pa siya. Ngayon, itong mga ito, yung head, chest, abdomen, sabi ko nga kanina, ay maaaring kuhanin only once pagkapanganak. Pero yung head, kung merong mga nervous system condition, maaaring i-monitor siya everyday. Yung abdomen naman, kung may mga GI problems, maaari din siyang i-monitor everyday. But other than that, ang dapat na kinukuha everyday or most, no, often is yung weight. Kasi dito natin nakikita yung nutritional status, kung kumusta yung growth and development and nutritional status ng baby. Okay, getting the birth weight every day. Next are the vital signs, no? Temperature, heart rate, RR, and BP. When you get a newborn's temperature. The normal is 36.5 to 37.4. According to DOH or WHO, ang 37.5 ngayon ay mild fever na. Pero syempre, tignan din natin yung temperature mismo, no? Especially during summer, na minsan mainit talaga ang panahon. The most accurate route is getting it rectally. But because it stimulates the vagus nerve or the cranial nerve number 10, it controls heart rate and RR. So, pwedeng magkaroon ng bradycardia, cyanosis. No? We do not usually do it routine. Ang advantage ng pagkuha ng rectal, number 1, is dahil accurate siya. Pangalawa, it can check kung merong imperforate anus or intestinal obstruction yung baby. But other than that, because it can stimulate vagus nerve, no, it's not totally recommended na kuhanin siya routinely. Okay? So, ang maaaring gawin to routinely check it, of course, axilla. No? Remember this, that all newborns are prone to hypothermia. Why are they prone to hypothermia? Number 1, because they have an immature hypothalamus. Hypothalamus is the heat-regulating center of the body. Number 2, because they have inadequate subcutaneous fats. It helps our body sa ating thermoregulation process. Number 3, there is no shivering mechanism among newborns. Pag tayo giniginaw, nag-goosebumps tayo or nag-chills. But newborns do not do that. And fourth, their body surface area is greater than their body weight. At dahil dun sa 4 na reasons na yon, lahat ng newborn, kahit healthy, they are prone to hypothermia. And hypothermia can cause a lot of complications sa baby. Una, hypoglycemia. Malamig na nga, nilalamig na nga, ginutom pa yung baby. Why? Kung nilalamig sila, they will use glucose as the primary source of heat. At pag ginamit nila yung glucose nila, glucose level will go down, will result to hypoglycemia. Pangalawang komplikasyon ng hypothermia, acidosis. They can use fats also as a source of body heat. Breakdown of fat, fatty acid. Accumulation of acids, acidosis. And lastly, respiratory distress. Nag-i-increase kasi yung kanilang metabolic demand. So, nahirapan pa silang huminga. Okay? And even the respiratory consumption. That's why hypothermia is a big problem kung hindi ma-thermoregulate ang bagong panganak na baby. Sa matatanda, pag tayo may infection, mataas ang lagnat. Pero sa newborn, hypothermia is also a sign of infection. Kaya nga ano yung first core step ng essential newborn care? It's actually drying the newborn. No? Kasi basa sila, di ba? Yung pagtutuyo sa kanila ay isang napaka-importanting intervention para hindi sila lamigin. Why? Because of evaporation. The 4 words you see on the side are different ways of losing heat. And evaporation is one. That's why the first core step is thoroughly dry the baby. Evaporation is loss of body heat. Yung init na natitira sa katawan ng baby, sasama pa siya dun sa nag-evaporate na liquid as gas into air. Kaya kailangan tuyuin agad. Other ways to prevent hypothermia is preventing also convection, conduction, and radiation. Ano yung convection? Transfer of heat to a cooler surrounding air. Kaya nga dapat ang delivery room ay nasa gitna lang ng 25 to 28 degrees Celsius. Kung masyadong malamig yung aircon, maaaring si baby yung init ng kanyang katawan sumama pa doon sa cooler surrounding air. Pangalawa is conduction, transfer of heat to a cooler surrounding object that is in contact with the baby. So dito, kaya nga dapat si baby binabalot natin ng blanket. At dapat yung pinambabalot natin sa kanila na blanket, na bonnet, should be warm. Okay? Kasi kung ito ay malamig, yung init ni baby sa katawan, sasama pa doon sa malamig na yon. And lastly, radiation. Transfer of heat to a cooler object not in contact with the baby. Kaya nga dapat, again, yung temperature din doon sa surrounding air nga, or yung paligid ay 25 to 28 degrees Celsius lang. Okay? Next is the heart rate. Normal heart rate is 120 to 160. Yung ranges niyan, 130s, 140s. Okay? The PMI, or the point of maximum impulse, is the apical pulse. Ang location niya between the third and the fourth ICS, left mid-clavicular line. Okay? When you get the baby's heart rate, do not get the pulse rate. You have to check the heart rate. Use stethoscope. Okay? Respiratory rate, normal is 30 to 60 breaths per minute. Now, in the photo, you will see here an apnea belt and an apnea monitor. Why? Because normally, in the first few hours of life, maaaring magkaroon ng episodes of tachypnea or physiologic apnea. Yung tachypnea at yung physiologic apnea should not be, especially the physiologic apnea, should not be more than 20 seconds. Bakit posibleng may tachypnea or may physiologic apnea less than 20 seconds? Kasi pagkapanganak ng baby, dahan-dahan pa niyang inaabsorb yung amniotic fluid na nasa lungs niya. Some may require oxygen therapy, especially with tachypnea. Okay? Yung physiologic apnea should only be less than 20 seconds. Pero kapag more than 20 seconds na yung physiologic apnea, meaning walang paggalaw ng chest, no inhale, no exhale movement. If it is more than 20 seconds, it's pathologic apnea and must be referred right away. Okay? Next is the blood pressure. The blood pressure is not routinely measured unless the baby is in the ICU. Pero ang normal systolic BP nila is around 60s. Normal diastolic ay nasa 40s. So, 60/40 mmHg. And of course, you have to use the right BP cuff na applicable or appropriate para dun sa size ng newborn. Next are the physiologic functions, yung iba-ibang systems ng katawan ni baby. First is the cardiovascular system. If you see in the photo, the fetal circulation is totally different with that of a newborn. Why? The primary reason is because hindi ginagamit ng baby ang kanyang lungs to get oxygen intrauterine life. Nanggagaling ang oxygen ni baby from the placenta. If this is the baby's heart, no, ito yung katawan ng baby, ito yung pusod niya, this is the placenta. The placenta has an umbilical cord, 2 arteries, and 1 vein. Artery, movement of blood away from the baby's heart. Vein, movement of blood towards the baby's heart. Therefore, if the oxygen comes from placenta, oxygenated blood ang daladala ng umbilical vein. Now, from the umbilical vein which carries oxygenated blood, konektado yon via ductus venosus sa inferior vena cava ng baby. Kaya sa inferior vena cava ng baby, you can see the heart of the baby is color violet. Bakit hindi pula? Violet kasi meron siya ang mixed blood. When you say mixed blood, combined oxygenated and not oxygenated. Unlike us, no, dahil wala na tayong placenta, sa lungs na nanggagaling yung oxygen, from the vena cava, all ang nanggagaling dyan are unoxy blood. But in a baby, it's a special circulation because ang pumapasok sa vena cava, sa right atrium, sa right ventricle, meron ng kasamang oxygenated blood coming from the placenta via umbilical vein, connected ductus venosus na nakadikit, naka-attach sa inferior vena cava. Okay, now, here you will see an additional structure which is the foramen ovale. The foramen ovale is an opening between the right and the left atrium. If you can see here, pagkapasok ng blood doon sa right atrium, dahil merong foramen ovale, dediretso ang oxygenated blood or the mixed blood doon mismo sa left atrium. From the left atrium, dediretso agad-agad sa left ventricle. And from the left ventricle, ipapump na siya papuntang aorta. Because of the foramen ovale, ano ang na-bypass? Ang na-bypass dyan, no, of course, is first is the tricuspid valve. Next, hindi na dumaan ng right ventricle. Hindi dumaan ng pulmonary artery. Hindi dumaan ng lungs. Hindi dumaan ng pulmonary vein. Diretso kasi agad sa left atrium. So dahil sa foramen ovale, may mga na-bypass yung blood, which is okay kasi hindi naman nakailangan dalhin sa lungs yung dugo. But hindi porket may foramen ovale dyan, wala nang opening yung tricuspid valve, which means even here, because of the tricuspid valve, may bumababa pa rin na mixed blood with oxygenated blood sa right ventricle. At dahil doon, diretso pa rin yung blood flow from the right ventricle, diretso siya ng pulmonary valve, and then pulmonary artery. But because of the ductus arteriosus, which is another function or another accessory structure ng fetus, ductus arteriosus is the communication between the pulmonary artery and the aorta, which means parang may bridge dyan. So pagkadating na oxygenated blood doon sa ductus, sa pulmonary artery, from the bridge, diretso ang dugo to the aorta and automatic madedeliver siya sa systemic circulation ng fetus. Ang ductus arteriosus ngayon, ano ang bypass? Dahil dyan, hindi na dumaan yung dugo sa lungs, hindi na dumaan sa pulmonary vein, hindi na dumaan sa left atrium, hindi na dumaan sa mitral valve, hindi na dumaan sa left ventricle, hindi na dumaan sa aortic valve. Diretso agad siya kasi from pulmonary artery to aorta. Okay, which reminds me, no, you have to review, of course, the normal anatomy and physiology of the heart, no? How blood flows in and out of the heart. So si foramen ovale at si ductus arteriosus ay dalawang accessory fetal structures ng heart, mainly because hindi naman na ginagamit ang lungs ng fetus. No? Ngayon, pagkapanganak ng baby, pag pinutol ang pusod, that's like a machine, parang makina ng sasakyan. Para mong inumpisahan yung makina ng lungs. That's gonna be the baby's first breath when you cut the umbilical cord. Why? Wala na yung oxygen supply niya from here. And that's when the baby is in the outside world. Pag first breath niya, automatic gumana na ang kanyang lungs. At dahil doon, magsasara dapat ang foramen ovale and ductus arteriosus. If there are cases na hindi siya magsasara, magkakaroon ng problema because magde-deliver ng unoxy blood sa systemic circulation. And of course, our cells need oxygen for it to live. May mga cases na ganito, lalo na kapag may mga congenital heart defects. Okay? So, ang foramen ovale at ang ductus arteriosus dapat magsara. In a matter of 12 hours after birth, dapat sarado siya. Pero yung approximate time of obliteration, meaning remnants na lang, ganito siya katagal. Pero in a matter of 12 hours, dapat magsara. Ductus venosus, 2 months. The 2 arteries and 1 vein, pinutol mo na siya nakat mo na siya in 2 to 3 months. And these are the structures remaining. Okay? Again, I mentioned that the first breath is initiated by a low PO2 and increased PCO2 with a pressure of 40 to 70 cm water in the heart. Kasi nga, in the respiratory system, Kasi nga, nung pinutol mo yung pusod, nabawasan yung supply ng oxy blood to the baby at nabawasan yung pagbabawas ng waste products outside through the umbilical cord also. Kaya magkakaroon ng first breath. Importante dito, syempre, para matulungan ang baby, yung enough surfactant. The LS ratio of 2:1, making sure that the lungs are mature. Okay? GI system. To help prevent bleeding, ini-injection na natin ang baby ng vitamin K injection. Okay, why? Because ang vitamin K, to prevent bleeding, nasisynthesize with the use of normal flora, meaning good bacteria in the intestines. Ang bagong panganak na baby, very sterile ang GI tract. That's why kung wala pa yung normal flora or good bacteria sa GI tract, wala pa yung enough formation ng mga clotting mechanisms ng katawan. Kasi magkakaroon pa lang naman ng baby ang normal flora pag siya ay nag-breastfeed na. Kasi sterile pa nga yan pagkapanganak na pagkapanganak. Okay, when you inject vitamin K, it's IM. It can be given in the vastus lateralis. Normally is 0.1 cc. Pero minsan may mga institutions na 0.1 cc per kilo. So if the baby weighs 2.5 kilos, 0.25 cc ang ibibigay mo sa kanya. Alright? Also, within the first 24 hours, there is a meconium. Diyan lalabas yung first stool. It's a sticky, tar-like, blackish green, and odorless. Second to third day, transitional. Green, loose, resemble diarrhea. Why? Kasi nga nagkaroon na ng pag-breastfeed or formula feed, kung ganun man ang binigay. Again, transitional siya, so nagkakaroon na ng good bacteria, hindi na sterile yung GI tract. From the fourth day onward, if breastfed, light yellow, sweet-smelling ang stool. Pag formula-fed, bright yellow, and may noticeable odor. Now, important din na minomonitor natin yung kulay ng pupu ng mga baby, because it may indicate some problems also. If the baby's stool is bright green, maaaring nabigyan siya or result ito ng phototherapy. Phototherapy will be discussed later on. Clay stooled or gray, maaring may bile duct obstruction. Okay? Minsan naman yung blood fleck, as in may bright red na dugo. Baka may anal fissure, baka may mga hiwa o sugat or lacerations along the anal canal. Black tarry stools kapag naman may intestinal bleeding. And lastly, pag mga watery or loose stools, baka may milk allergy or lactose intolerance si baby. Okay? Next is the urinary system. Kidneys do not really concentrate urine well. Even if mature na si baby, hindi pa ganun ka-effective, no? But initially, mag-i-improve yan in several days. Urine is usually light in color and odorless. Specific gravity, 1.008 to 1.01. Imagine the daily urine output in the first 2 days of life, 30 to 60 ml. While in adults, ang 30 to 60 ml is per hour. By the first week, dumadami na siya, 300 ml. There is a small amount of protein present in the urine that's normally present in the first few days kasi nga hindi pa ganun kagaling mag-concentrate ng urine ang kidneys, no? But eventually, dapat mawawala ito. Autoimmune system, if you look at the graph, initially, no, ang taas-taas ng IgG ng baby at birth. The blue one is the IgG. IgG is the only immunoglobulin that crosses the placenta. Kaya ang taas-taas ng IgG ng newborn kasi maraming ibinigay si mommy na ganyan. No? But IgG is important for secondary infection. Kaya kahit mataas yung IgG ng newborn, prone pa rin sila sa infection kasi IgG is for secondary infection. IgM ang primary infection or acute infection. Pero as the baby is born, unti-unti tumataas na rin yung IgM, IgG, IgA, meron ding IgD. Now, this is the neuromuscular system. Ang neuromuscular system is a very important system to check how well is the development ng brain, no? Ngayon, reflexes are important to check the effectiveness of the neuromuscular system. Now, lahat ng ito wala na sa matanda. Nawawala ang reflexes because another developmental milestone will occur. Ang naiwan na lang na reflex sa adults ay ang deep tendon reflex. Okay? But ito, minsan nga yung iba sa kanila, intrauterine life meron na. So ano itong mga reflexes na ito? Motor reflex is the startle reflex. So kapag sila ay nagulat, no, with strong sound, nag-extend yung kanilang upper extremities, nag-flex yung kanilang lower extremities. It's strong for the first 8 weeks of life and fades by the end of the 4th or the 5th month. Now, meron ng motor reflex intrauterine life. Evident na yan. Kailangang mag-fade ang moro. Imagine pag hindi siya nag-fade, paano matututong mag-crawl ang baby? Paano siya matututong maglakad? Paano matututong maging coordinated ang movement niya? Kung bawat rinig niya sa isang nakakagulat na sound, mag-motor reflex siya. Okay? So again, reflexes fade so that another developmental milestone will occur. Grasp reflex, no, the palmar and the plantar. Si palmar, no, sa kamay, this appears 6 weeks to 3 months. Plantar sa paa, this appears at about 8 to 9 months. Now, when you say reflex, automatic kasi siya. Kaya mo pa rin gawin yan, yung mag-grasp. Pero hindi automatic gaya nung palmar and plantar reflex na bawat masense mo sa kamay mo, hahawakan mo. Bawat masense mo sa paa mo, hahawakan mo, no? Or if-fold mo yung iyong fingers to grasp it. Now, importanteng mawala ito so that you would learn how to use your fingers to pick up something, no? Or, sa paa naman, how will you be able to stand kung hindi mawawala ang plantar grasp? Okay? Walking reflex or the step-in reflex, this appears by the 3rd month of age. Ano tong reflex na to? Pag yung talampakan ni baby, nakaramdam ng flat surface, may tendency siya na para siyang nagsistep in place. Step, 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 step. feeling ng mga magulang, ay, naglalakad na siya. No, it's just a reflex. No? It disappears by the 3 months of age. Tonic neck reflex, the boxer or the fencing reflex disappears by 2 or 3 months. Ito naman, kung saan nakaharap yung face, no, the same side, the same extremity is extended, the opposite extremity is flexed. So halimbawa, ito nakatingin yung baby sa left side. So the left upper arm is extended, the right upper arm is flexed. Okay, dito nakatingin sa right, so straight yung right upper arm, flex yung left upper arm, which is similar to the lower extremities. Extended kung saan siya nakaharap, flex yung opposite side. Okay? Again, that's a reflex and it fades. Babinski. So, ang Babinski reflex remains until 3 months. Meron na rin ito even sa fetal life. Okay? Ito yung fanning of the finger toes with stimulation ng talampakan nila. Okay? Tayo nakikiliti din, no? Pero hindi siya reflex na nagfa-fan out yung toes mo. Okay? Sucking is also a reflex which should be very strong in newborns but diminishes by 6 months of age. What do you mean by this reflex? Again, we know how to suck. Adults know how to suck, but it's not a reflex na lahat na lang ng ilalagay mo sa bibig o madidikit sa bibig mo ay isasak mo. Okay? Swimming reflex is very evident also in newborns. In fact, ang newborn, kapag ihinagis mo siya sa pool, meron siyang reflex to swim. So, ikakampay niya yung kamay at paa para makaswim. Pero pag matanda ang hinagis mo sa pool, malulunod sila. No? Wala na yung reflex. Okay, that's why there are some swimming instructors who tell that newborns or even children, mas madaling turuang lumangoy kaysa sa matatanda, no? Kasi may swimming reflex ang mga bata. Another is rooting reflex. So if you stimulate using your fingers the side of the cheeks, hahabulin nila yon, no? Para isak. It disappears about 6 weeks of life, and the rooting reflex is important to help the baby breastfeed. Swallowing reflex, so na ilulunok nila kung ano man yung mapunta sa kanilang bibig, especially if it goes out through the posterior part of the mouth. Kaya nga, hindi pwedeng kumain muna sila ng mga solid foods kasi automatic lulunokin nila yan. Unlike tayo, ang matanda, we will chew it first before we swallow. Pero sila, reflex, automatic, lulunukin. Okay? Everything that touches the posterior part of the mouth, which is opposite of extrusion. Kaya yung mga bata makalat kumain. Kasi pag nasa anterior part lang ng kanilang mouth, naluluwa or niluluwa naman nila. No, yun yung extrusion reflex. It also disappears by 4 months of age. Foot placing. So, yung anterior part ng leg, kapag may na-touch na hard surface, meron siyang instinct to step on it. Yun yung foot placing reflex. Okay? Trunk incurvation reflex. So, pag nakalay prone yung baby, stimulate the left side of the back will stimulate the baby to curve on that side. Pag ito naman yung stimulate mo, mag-curve siya on this side. Okay? Lando or the parachute reflex. This is very strong among older infants. Okay, as shown in the picture. Ito, hawak lang naman yung chest. Pero kung mapapansin mo, walang head lag. Tapos yung legs in-extend. Sometimes even the arms i-extend. So feeling nila lumilipad sila. No, parang parachute reflex. Okay? Cross-extension reflex. Ito, ang stimulate talaga dito is the right leg. As a reflex, merong instinct yung right leg na alisin yung na-stimulate doon sa left leg. Kaya siya cross-extension reflex. Okay? Ito na lang ang natira ngayon sa adults. Ang deep tendon reflexes. So, lahat yon nawala na pag adult ka na. So, only the deep tendon reflex now will check how well the neuromuscular system is. Okay, yung mga reflexes. Using a neurologic hammer or a reflex hammer. Normal score is +2. So, yung mga negative, maaring hypotonic yung muscles o kaya yung mga +3, +4, very active or hyperactive yung muscles. Ano yung mga chine-check sa deep tendon reflexes? We have the biceps reflex, the triceps reflex, the brachioradialis reflex, the patellar reflex, and the Achilles tendon reflex or the ankle reflex. So sa health assessment ninyo, you were taught how to check these reflexes. So dapat may automatic na pag-jerk or pag-twitch ng muscle as you stimulate the deep tendon using neurologic hammer or reflex hammer. Again, normal result is a +2, which means that the neuromuscular system is effective or functioning well. Okay, what about the senses? Hearing, vision, touch, taste, and smell. Hearing is very strong. Intrauterine life, it becomes very strong. In fact, sa lahat ng senses, hearing is the first to appear and the last to disappear. So, intrauterine life pa lang, malakas na yung pandinig ng mga baby, kaya parents can actually talk to the baby inside the womb. Tapos, sa isang taong mamamatay na or comatose, even if you talk to them, no, sometimes they can even hear it. Vision, ang unang kita ng mga baby is just black and white. Kaya nakakatulong sa kanila yung areola na nag-darken sa buntis kasi very evident sa kanila yon na black and white siya. No, also, they can see clearly only in a 12-inch distance, 1 foot. That's why pag nagbe-breastfeed yung baby, nagre-register ang mukha nung mommy niya sa kanya. Kasi yung layo nung breast niya from the face of the mother, no, pagkarga siya ng mommy niya habang nagbe-breastfeed is enough para makita siya ng baby. Okay? Yun lang muna yung una niyang nakikita sa newborn. Sense of touch, no? Most babies want to be cuddled, to be carried. Gusto nila yon. Pero minsan may mga baby na ayaw makaddle, ayaw matouch. Sometimes, no, it may be associated with autism. No? But of course, it has to be checked further. Sense of taste, no? Ang panlasa nila sa breast milk, ang panlasa nila sa lahat ng milk, matamis, masarap. No? Sense of smell, they can recall smell. Yung amoy ng kanilang primary caregiver, no, nakikilala din nila. Okay? Now, what are these reactivity periods? These reactivity periods are how the baby adjusts to extrauterine life after birth. Okay? Sa first period of reactivity, initially ganitong itsura ng bagong panganak na baby. Dapat gising, walang babing tulog pagkapanganak, lahat gising, lahat dapat umiiyak, no? Bakit? Kasi merong sudden change in the environment. Nasanay siya sa masikip, mainit, at dark na environment sa womb. But suddenly, lumuwag, nagkaroon ng space, lumamig, no? At lumiwanag. So, may sudden change, adjustment agad yon for the baby. Kaya yon ang kanyang first period of reactivity. It's normal for the baby to be awake to cry because of the sudden change. And again, this will stimulate breathing. Usually, this occurs for the first 30 minutes. Next, after nun, dapat ma-stabilize siya. Resting period after 30 minutes. So, kailangan nga, di ba? Stable siya, skin-to-skin contact initially, no? Tapos, dapat ma-warm. Dito, totally nag-a-adjust na siya sa extrauterine life. Yung kanyang vital signs unti-unting nagiging stable. Hanggang sa second period of reactivity. Dito, yung panahon, nagigising ulit yung baby. Dito, naka-adjust na siya sa extrauterine life. Okay? And of course, dapat very stable na ang kanyang vital signs. Okay?